you can get away without missing out. Whether you're traveling across Idaho or just spending more time outside, the Connector keeps you up to date with the local stories that matter, from wildfire season to community news. Stay connected to Idaho with the Connector, Idaho Daily News. Listen wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Our state has its first confirmed case of West Nile virus meningitis this year, and health officials say West Nile has already been detected in mosquitoes in several Idaho counties. So, what should we know about all of this? It's Wednesday, which means it's time for our Doctor Roundtable with Dr. David Pate. He is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. Okay, Dr. Pate, when people hear West Nile meningitis, that sounds a bit alarming. So how does a typical West Nile infection turn into something more serious?
Yeah, so there are certain people that if their immune systems cannot control the virus sufficiently, and certainly that can happen with people who are immunocompromised, and including by age. Everyone after age 50 is at risk. And certainly as you get older, you get some weakening of that immune system, but also people who are being treated for medical conditions, that are on medications that suppress the immune system. We don't know what this gentleman's situation is, or this person's situation is, other than that they were over 65. So most people who get West Nile virus are going to not have as severe disease, and severe disease can include meningitis, as has been reported in this person, but also encephalitis, which is an inflammation of the brain, and even paralysis, myelitis, where it's inflammation of the spinal cord, those kinds of things. Those are very serious conditions, but fortunately rare. More often, people who get West Nile infection are going to have fever, headache, muscle aches, nausea, and some will, not everybody, but some will even get swollen lymph nodes or a skin rash.
Okay, so Dr. Pate, what symptoms should then prompt someone to, call their doctor or seek medical care?
Well, certainly if, with these severe cases, it's going to be fever, bad headache, weakness, confusion. You're talking with the person and they're not making sense, or they're obviously seem off. Any of those kinds of signs should cause you to seek urgent attention. Milder cases may be harder to tell, but West Nile virus needs to be considered when it's summer to fall months, the months like now that are typically not as high levels of other kinds of viruses that we will be dealing with coming later this fall and winter. So that can be a tip-off. So we usually see West Nile during the summer to early fall months.
Okay. And so as we mentioned, when we're talking about the average person, when it comes to West Nile, Dr. Pate, how much should we be thinking about mosquito protection right now? And what precautions actually would make the biggest difference?
Yeah. So now that we have the counties do routine surveillance of mosquitoes. They set mosquito traps at different places, and then they test the mosquitoes. And given that these mosquitoes have tested positive both in Ada and Canyon counties. We should assume, for those of us that live in the greater Treasure Valley, that there is some degree of risk. And so now, until the time when we get a hard freeze and the mosquitoes kind of die off, we should just be extra careful. Now, these particular mosquitoes are not as active and prevalent during the middle of the day. They like when it gets to be dawn, and they circulate until it becomes dusk. So for most of us, we're not going to be out and about. But if you are out during those times, either because that's your social schedule or that's your work schedule, then be extra cautious. And so if your kids are going to be playing outside, if you're going to be camping, going to be out, certainly use protective clothing, to cover as much of your skin. But when it's hot, that may not be attractive. So then use mosquito repellents, particularly those that contain DEET in them, DEET. And just be conscious that if you're going to be out in those after hours, that's when you've got the time and the risk for getting the mosquito bite.
I want to turn now, Dr. Pate, to some issues around COVID, because as a lot of us know, kids in the Treasure Valley are back in school. And now we have some wastewater testing showing that COVID-19 levels are climbing across the city of Boise. So, of course, this is raising questions about whether we could potentially be heading into one of those, late summer waves of COVID. So, Dr. Pate, wastewater testing is showing those high levels and an upward trend over the past few weeks. So what does that actually tell us about how much COVID is circulating in the community right now?
Well, it tells us that there is a lot. And in fact, I am convinced that we are at the beginning of a new wave of COVID. And the reason is because we're seeing this across the country. Now, oftentimes Idaho kind of lags behind many of the other states. In this case, the Boise wastewater is testing higher than most states. So we may actually be on the front end of this wave. But nevertheless, if you look across the country, wastewater is increasing positivity for COVID, for that virus. Across the country, that tells me we do have a wave coming, and of course, as you mentioned, with noting that it is the time that everybody's going back to school, we have known for decades that schools are how influenza spreads predominantly. When we have influenza epidemics, usually it starts with our kids in school. For the first couple of years of COVID, frankly, I scratched my head thinking I'm not seeing the evidence that schools are driving these outbreaks of COVID, which would be a bit unusual. But later, as we got more and more data and looked back, we can now see that schools are also a driver of COVID. So, given that we've got high levels already, given that the kids have gone back to school, given that we're seeing an uptick across the country, I fully expect that the kids being back in school will accelerate this wave. So I expect it to continue. I expect it to grow and probably grow faster because kids will contribute to it. They will bring it home to their families. So it is a good time to think about if you've got high risk people in the families where there are school children, of planning your steps for protection and for care if you need it. but also contemplating that once the new COVID vaccine becomes available, the 2026-27, that you might consider getting that new vaccine to help protect.
Okay, so can we talk about that new vaccine? Do we know at this point, Dr. Pate, when and if we could see that updated COVID booster? Normally, we've seen it in September.
Yes, and even as early as August. And so this is a confusing year for people like me to know exactly what to be able to tell you, because although the FDA has approved this new vaccine, the CDC has not signed off on it. Now, understand that the CDC's vaccine committee, called ACIP, or the Advisory Committee on Immunization Practices, has been disbanded by court order because, frankly, these people were not qualified and were just doing some ridiculous things. But it has not been reconstituted yet. And therefore, that does cause some confusion, because generally they would have met by now. They would have reviewed the information from the FDA about the vaccine. And they are the ones that give the specific guidance as to who should get the vaccine, when, how many doses, that kind of thing. And they have not met, obviously. Then that would be a recommendation to the CDC director, who would sign off on it. And not only is the vaccine committee disbanded and not reconstituted yet, we just have a brand new CDC director. And so I have not seen or heard anything that has expressed her intentions. We know this administration is very hostile towards mRNA vaccines. So I'm frankly not exactly sure, although many of my colleagues seem to be of the mind and reassured that we probably will see the vaccine next month. I certainly hope that's true. I just can't commit to it at this point, but be on the lookout. And obviously on your show, Gemma, we'll be announcing when pharmacies and doctors' offices are getting the vaccine, but we're got fingers crossed for next month. And that would be very important, given that we're starting to see the uptick in these in COVID.
So, Dr. Pate, the number of U.S. kindergartners receiving exemptions from routine vaccines has reached a record high, and vaccination rates for diseases, including measles, continue to slip. So, vaccine exemptions among kindergartners have nearly doubled since the 2020-21 school year. Dr. Pate, what do you think is driving that increase, and how much of this is vaccine hesitancy versus families simply having trouble, getting access to care?
Well, I think it's a combination of a variety of things. I think that vaccine hesitancy plays a very major role. I think that although there is a lot of untrue information circulating around, I think that a lot of well intentioned parents are just confused. Well, wait, is this a concern, or is this not a concern? And unfortunately, our human behavior is typically that if we're unsure, then we think we're being safe by not taking action. And unfortunately, in this case, if we don't take action to vaccinate our children, something that we've done for many decades without major issues, then unfortunately, some of those children are going to face serious problems. And of course, it makes my heart break for those parents who will then feel tremendous guilt. I remember listening to parents in Ohio just distraught over what happened to their child when their child got measles. And and telling other parents, listen, we fell for the disinformation. Please don't do it. Certainly, we still have healthcare access issues, especially in single parent or double parent homes where both are working full time, and it may be difficult to get their child, or they may not have insurance. So we certainly do have access issues, but I think a lot of it is hesitancy, and then a much smaller part is that group that is truly anti-vaccine.
Mm. So, Dr. Pate, the national MMR vaccination rate is, according to health officials, now at about 92%. That is below the roughly 95% that is needed for herd immunity against measles. So, at what point do declining vaccination rates translate into a meaningful increase in outbreaks?
Well, we're already seeing it. So we have had major outbreaks in Texas, South Carolina. Now we're having it in Pennsylvania. There's been other states as well. We're seeing this across the country. We have not had as big an issue here in Idaho. We have had some cases. I am hoping that our vaccine rates are actually higher than the numbers that are being touted. And I think there's some reason to believe that it is. But unquestionably, the trend that we are on, coupled with the utter nonsense that you and I discussed last week with the new executive orders and
Mm.
some of the comments being made about those, I think we're in for some trouble. And of course, as I've often said on your show, measles is the canary in the coal mine. You're going to see measles outbreaks first, just because that's the most contagious virus that infects humans that we know of. But I think stay tuned, because I am fearing that we are going to see quite a number of other diseases that people have forgotten about because they've been so well prevented with the childhood vaccine schedule, that now that we are having problems with kids getting vaccinated, I think we're going to start seeing some of these other diseases. We already are seeing some of them in other countries. And let me assure parents, you do not want to watch your child die of tetanus or diphtheria. I mean, these are horrendous ways to die. It's and there's others. I'm sure we're going to be seeing more pertussis or whooping cough outbreaks, as you and I discussed a couple years ago. We were seeing outbreaks. So I think many of these other ones are coming.
So, Dr. Payne, I want to turn now to the mRNA flu vaccine, because as we talked about earlier, the FDA approved the first mRNA flu vaccine for adults over 50. But its future is a bit uncertain because of what's happening with ACIP. So, what still has to happen before this vaccine can actually become a routine option for patients?
Yeah, so this one, I gave my answer about the new updated COVID vaccine, and I do feel, I feel uncertain, but I do feel a bit more encouraged about it, because it's been previously authorized. Uh, but I am worried about this one. We're in an unprecedented situation, and I have not had a chance to review the statute and the regulations. about what to do in this kind of a situation where we don't have the advisory committee, and whether the CDC director can give that authorization on her own, or whether she can only do it upon advice of ACIP, although clearly she doesn't have to accept the advice of ACIP. So I'm hopeful that the CDC director can authorize this vaccine so it can be available. On the other hand, we know the Trump administration is very hostile towards mRNA, and I would be a little bit surprised if the new CDC director would go ahead and sign off on it. But my fingers are crossed. But I think we're just going to have to wait and see. I feel less confident about this one. But I'm very hopeful, and we're just going to have to watch it week to week. But on the other hand, we've got more time with that one because it is too early to be getting the flu vaccine right now, whereas COVID is going to be a pressing issue shortly.
Okay, very quickly, Dr. Pate, before I let you go, you said it's too early to get that flu shot, but you've already talked to somebody who got their flu shot. And I have to say, I'm seeing signs at pharmacies saying the flu shot's available.
Yes, and I wish this person had asked me first, but unfortunately, the flu vaccine does roll out to pharmacies and they start marketing it right away. But it is too soon. And the reason it is too soon is that the flu vaccine is one of those that wanes relatively rapidly. And so a flu shot today is unlikely to continue to provide protection through the entire flu season. And if it's a normal year, and we don't know if this is going to be a normal year yet, but I'll be watching that. In a normal year, we would see influenza start to take off, probably in early to late November. And so we want to time getting the flu shot to when we start seeing influenza cases rise. We can see it earlier, we can see it later, but I'll be watching that and we can let your listeners know. But getting the vaccine now likely means you've got coverage that's going to be wasted for the next few months when you'd rather have that added on at the end. So wait to get your flu shot. Too early right now. Unless you're just the kind of person that if you don't get it now, you're not going to get it, then of course, go ahead and get it. But if you are willing to time it, wait, it's too early.
All right. As always, Dr. Pate, we so appreciate you. You've been listening to the Idaho Matters podcast from Boise State Public Radio. To stay in touch, you can find quick Idaho daily news every morning when you subscribe to the Connector podcast. And if you haven't yet, could I ask you to leave us a review wherever you listen? We read every single one, and we'd love to hear from you.